I'm Mary Beth Marsden, and welcome to a special edition of Greater Living. Thanks so much for being with us. I think we can all say that 2020 has been an incredibly challenging year for most of us, if not all of us, but especially for our healthcare providers. But we as a community are so thankful for their hard work, their dedication in the midst of everything that's going on right now. And we're so excited that GBMC can offer another resource for all of us, for our community. So if you need a primary care provider, we have another resource now available in Baltimore County at Padonia. Let's take a look.
Hi, I'm Dr. John Chisar, the President and CEO of the GBMC Healthcare System. I'm delighted to be here today with my colleagues for the official grand opening of our latest patient-centered medical home, Advanced Primary Care Center at York and Padonia. You know, about 10 years ago, our board set us on a vision to become the community-based system of care that could deliver to everyone every time the care we would want for our own loved ones. And the patient-centered medical home is our fundamental building block to do that. So I want to thank Practice Manager Erica Easley and Physician Lead Dr. Sarah Whiteford for their great work in getting us to this point. And I'm just delighted to help patients in this new site move towards their own better health. Thank you. And now let me hand it over to my colleague, Dr. Sarah Whiteford.
Thank you, Dr. Chisar. Welcome to Padonia, our newest primary care practice. I'm Dr. Sarah Whiteford, family care physician and lead physician at our newest practice. Redesigning the primary care space and delivering the care for the past decade has been the highlight of my career. From our first trip across the country to see a revolutionary way care was being delivered in the primary care setting, to bringing that knowledge to Baltimore and our offices was a true joy to witness come to life. I am so excited to lead the team here at Padonia, extending our services even further into Baltimore County. In addition to primary care, we are excited to offer gynecology, urogynecology, pelvic floor therapy, orthopedics, and physical therapy in this 1,400 square foot space as well. Our goal, no matter what, is to treat you and your family in a safe and comfortable environment, and that does not change with a global pandemic. I and the rest of the team here are here for you, masks and all. Looking forward to seeing you soon. And now I will hand this off to Dr. Hal Tucker.
Thank you, Sarah. Hi, I'm Dr. Harold Tucker, Chief Medical Officer of GBMC and the leader of GBMC Health Partners. GBMC Health Partners is our multi-specialty group of physicians associated with GBMC. We are delighted to be opening Padonia office to further expand the care of our patients throughout the Northern Baltimore community and metropolitan Baltimore. It's an exciting new venture for us to be associated with this office site, in addition to our 11 other primary care sites throughout Baltimore and Baltimore County and Harford County. We welcome all patients, and we look forward to being able to continue to provide the best care possible in a most compassionate way. Thank you.
And now we're excited to cut the ribbon.
I just drove by the campus at Padonia, and it's beautiful, it's modern, there's plenty of parking, which is awesome. And we want to find out more about what's happening there and talk to some of the doctors and nurses who are involved. And joining us right now from Padonia, from GBMC Health Partners at Padonia, is Dr. John Hennessy. John, thank you so much for being with us.
Thank you for having me.
You have a special interest. You're in a family physician, but you have a special interest in sports and particularly in youth sports. So I'm guessing you'll be seeing a lot of kids.
Certainly the hope. As a family physician, our training is all aspects of the family. We even include obstetrics in our training, although regionally we don't provide obstetrical care as family doctors, but we do provide care to individuals from birth to all the way through the life spectrum. And we feel that in doing so, we really can take care of the family. And of course, part of taking care of the family and the individuals within a family is making sure that we are physically fit, and in doing so, preventing the multitude of health problems in our society. Of course, right now that's hard to balance with COVID, and so in my other aspects of my life, including being a father and also being a soccer coach and president of a local grassroots soccer organization, I've been very involved in trying to figure out how to keep kids engaged in sports and also be safe in the current environment.
How are you doing that?
Well, we're looking for guidance from our local health authorities, and that guidance has come in fits and starts throughout all of this. We've also sought out experts in both infectious disease and pulmonary critical care and how to best do this. And we started off with doing Zoom practices and progressed to 6x6 boxes that were 6 feet apart to deciding to use masks and practice within our club. The CDC has some very good guidance that we'll probably post some of those website links later in this feed. But the CDC has some great guidance. So does the city and the county. Unfortunately, today we were just told that the city is putting youth sports on hold at outdoor city locations. Doesn't mean kids can't stay active, and doesn't mean their teams and coaches can't stay engaged with them. And I encourage everybody to do so to keep our kids active and healthy.
We're in a situation right now where I think it's going to get worse before it gets better. There'll probably be some more closings before the springtime, of course. How do you know at this point if most of the clubs or most of the organizations are following the guidelines the way they should? And what recommendations do you have for families who have these very active kids who want to be out there and they've got to figure out a way to channel that energy?
Yeah, I think it's really important to have a real open dialogue with whichever youth sports organization you're involved with. And then, take it upon yourself to review some of the recommendations from the greater national organizations and make sure your club is following suit. And, it's certainly upon all of us as, parents to take that opportunity to help out organizations that you're involved with, whether they're grassroots clubs like the one I belong to or paid professional clubs. It's still helpful to have input and make sure that everybody is following guidelines to keep our kids and their loved ones at home safe.
And so what would you say to families? I'm sure you've had families, you've talked with them, you're treating patients, and they say, we're just struggling to figure out how to keep our kids active and, let's say, off their devices all day long.
Sure, right. So, first of all, we all grew up playing outside after school without organized sports. And I think part of the problem right now in the state of our country is that we look to organized activities to keep our kids exercised. And, there are plenty of family activities you can do outside that don't involve exposing your children to other people. And I strongly encourage you all to do that while there are restrictions in place that limit any exposure to other individuals. And then as those restrictions loosen, going back to our organized sports in a way that is healthy and follows guidelines from the CDC and other youth sports organizations.
I would imagine that you struggle with the maybe the controversy around closing or not closing, reacting to the numbers or not reacting to the numbers. But on one hand, you're a doctor, you're a scientist, you believe in data. On the other hand, you're a coach, you're a parent. You must struggle with those two things.
Well, absolutely, particularly right now where, kids are by and large at home on their screens all day long. And it's very easy to just, turn off the feed to your school and turn on, Minecraft or whatever other game kids want to play. And it's completely understandable and natural for them to want to do that. And frankly, it also is an opportunity for them to be social, but they need to move their bodies. And moving their bodies helps with emotions, which is something that's plaguing children right now, not being able to socialize in the way that they are, intended to. And also it helps with immune process in helping prevent infections. So, we need to balance this, and I think most organizations have found ways to do so that have maintained kids, activity levels while also maintaining their health. Unfortunately, right now the case count is going up, and so we're starting to shut down organized activities. But kids really should continue to be active as much as possible, and you can do so by being socially distanced and wearing your mask. In my club, we chose to wear masks through the whole summer. We practiced within our own organization, and we had no incidents of infection. And I never had a kid complain about wearing a mask. They wanted to exercise, they wanted to play soccer so bad that they just didn't mind wearing the mask. Now, I will say, we played around with the different types of masks to find one that the kids really were able to exercise in without impairing their ability to breathe. And I think that's also important to remember. If you try a mask and it doesn't work, try a different one.
Do you feel comfortable saying what mask that was?
Yeah, the masks that we found that worked the best were just regular paper masks like the one I have on right now, that are typically worn in surgery. And we found ones that were sized appropriately for kids. And as you can see, if I take a deep breath in, it doesn't suck in and cause a seal on my face. And I think that's the downside to some masks. When kids do breathe in and it causes a seal, they feel like they can't breathe and can sometimes cause panic. So that's really important. The other thing that's really important is to make sure coaches have an area that all kids can go and have their masks off and be distanced from everybody else. In my organization, we make a triangle, and all those triangles are 6 feet away from every other triangle. At any point during practice, a kid can just leave play, walk into the triangle, take their mask off, take a drink, and know that they're being safe in terms of being exposed to anybody else.
Let's talk about the new practice at Padonia. Can you describe the facility?
Well, we have a fantastic new facility that is set up in, as the video suggested, in the most modern way that primary care is being practiced, and full of new technology. It is a really wonderful place that I think reflects the effort that we're putting in to keep people healthy. All the patients that have come and have commented, not only like on the parking that you suggested and how easy it is to get here, right off 83, but also how clean and new the practice looks, how bright, vibrant, and pleasant everybody is in the front of the office, to hopefully getting people in and out in a timely manner and in a way that makes them feel safe during this time of COVID.
It's pretty exciting. I don't think you can downplay the convenience aspect of it either, because right now everything seems so inconvenient that it's really nice to know that you can have a place to go that is easy.
I think that's really important, and hopefully that will be something that people keep in their minds even after COVID is a memory, which hopefully will be sooner than later.
Well, Dr. Hennessy, thank you so much for joining us today, and good luck with your team and keeping everybody active despite the pandemic. Thanks for being with us. And we were talking a little bit about what you can expect when you go to the practice at Padonia, and we have a video to show you.
Hi, welcome to GBMC Health Partners at Padonia. I'm Alex. When you come to the Padonia Station office, the first thing you'll do is check yourself in at one of our kiosks. They're super neat and high tech. They are antimicrobial, so they're kind of self-cleaning. That said, of course, with COVID, we're wiping them down in between patient use typically. If you ever have an issue yourself, we have wipes available for patients to wipe down as well. We have our check-in desk right over here. And if you want to say hi, we've got a couple people here. This is Tiffany. She could check you in or help if you have any issues with the check-in kiosk. We've got Asia over here, and she is one of our PSAs at the GYN office, so she's here most days as well. After you check in on the kiosk, we'll just check in with you as well, make sure that we have everything we need for you. And then instead of doing paperwork on paper, the way you do at other offices, we have some tablets we'll give you, and it has all of the information you need, and it can go right back to the room with you. One of the things we're really happy about moving to this Padonia office is that we've expanded to a new location. This Padonia location in Timonium is really helpful for a lot of patients who can't make it to the campus or to any of our other offsite locations. We're finding a lot of people just walk by, drive by, stop by to see our beautiful location, and next thing we know, we have them as patients. When you look around the office, it's beautiful, it's well lit, everything is brand new and state of the art. Everything's in working condition, and we have lots of technical help to help our patients work their way through their appointment. One of the things they kept in mind when they designed the Padonia office was the safety of our patients, especially now with the coronavirus going around. We need to keep everybody safe and sound. So even though we have a lot of surfaces, we're able to wipe them down sufficiently throughout the day. All of the doors are cleaned regularly, the kiosks and the tablets. We try to keep as few people in our waiting area as possible. Once a patient checks in, we quickly speak with them, get their temperatures and do all of their screening, and we get them directly into a room. Our rooms were all designed with helping patients know where they're going, so that's kind of a little bit user-friendly for patients. We have different colors for which area of the office you're in. We have a hallway like this one that has blue paint on the walls. I'm not sure if you can see it on camera, but this would be one of the hallways for our family care office. Down the other end of the office, we have some yellow paint on the walls to let you know you're on the specialty side. Coming to work each day is a joy. Coming to this Padonia office is beautiful. We're working with great people, great equipment. We've opened ourselves up to a whole new community, and we're happy to serve the people who come here every day.
And in case you haven't noticed it yet, what's really unique and wonderful about the new Padonia practice is the real patient-friendly approach and a very unique and modern setup. Joining us to talk more about what's available there is Kelsey Terrones, who is a family nurse practitioner at Padonia. Kelsey, thanks so much for being with us.
Hi, Mary Beth. Thank you for having me.
I think a lot of people know, but I think maybe a lot of people don't know too. What exactly is a nurse practitioner?
So a nurse practitioner is a nurse that has obtained their Bachelor's of Science degree and then goes on to obtain their either Master's of Science degree or their doctorate. And they also complete either family nurse practitioner program, or there are also other different tracks that they can complete as well.
And how is this different from, let's say, a physician's assistant?
So physician's assistants, I believe, go through and they're master's prepared. So they go through their usual undergrad, and then they also have practicum. This is also different from the medical track. So instead of going to medical school and having residency, the nurses really rely heavily on their experience on the floor and working as a nurse, and couple that with the advanced degree.
All right, so Kelsey, you are a family nurse practitioner. I'm going to assume that that means that you see patients all ages.
Yes, so just like Dr. Hennessy and Dr. Whiteford, we see patients from the minute they're born as newborns all the way up to the end of life, which is very rewarding.
That must mean you must have to really have a knowledge of, your knowledge base must be huge.
Yes, so I was always taught that primary care is the gatekeeper to other care. And so we definitely do have a wide range of knowledge, but we also know exactly where to go if there are some things that we really are not our area of expertise.
Okay, we've been talking so much and focusing probably not enough on what members of the medical community have been dealing with, particularly right now in this pandemic. Can you just talk about your personal experiences? I'm sure that things are a little bit slower when it comes to COVID at the Padonia practice, but in general.
So it's actually rather interesting. We, at least, I think between the three providers and I, at least 2 or 3 of our visits, and we average maybe 15 to 20 patients per day that we see, at least 2 or 3 of those are calls for people that may have been exposed or showing symptoms. So we are finding that it is more prevalent throughout the community. I do want to give a quick shout out and thank you to all of the urgent care providers and also the providers in the hospital, because they really are on the front lines of this. A lot of the patients that we see who present with COVID symptoms usually can be managed well at home. But I also encourage my patients, if there's ever a doubt or you have any trouble breathing or just feel you need emergency care, don't hesitate to go. The hospitals are safe. The risk of you getting COVID in the hospital is similar to you going to the grocery store and walking around with your mask.
And Kelsey, of course, if someone comes to your practice with symptoms, there's a complete integration with the main hospital, right?
Yes, so we do call the emergency room providers, and we do like to give what's called a warm handoff. So we let the ER providers know, hey, I've seen this patient. This is what I found. I really think her care needs to be expedited, or things along those lines to really help tie in the care nicely.
Of course, what makes this time also kind of unique is that, and not in a good way, is that we're also dealing with the flu, and we're in flu
Yes.
season. So are you seeing sort of flu cases as well? Are you trying to differentiate between the two?
So that's actually rather tricky, and I'm very interested. So we're trying to see how we can go about testing for the flu as well as COVID. And then also we have strep throat to throw in there as well, that also presents sometimes with similar symptoms of fever, sore throat, and also abdominal pain sometimes and headache. So testing right now is really the key. I would recommend, just call your primary care provider if you start feeling ill for any reason, and really go through the symptoms, and they can absolutely help you kind of suss through which kind of testing would be necessary.
And of course, at this point, we can test for everything, right?
Yes. So right now we're in a little bit of a challenging spot, because we are trying to keep patients who have any kind of COVID symptoms out of the office. We would do a video visit with them. GBMC has a lovely COVID testing tent, which I believe we are now setting up to do flu testing. So that should be very helpful for us in discerning the diagnoses, because treatment is a little bit different between the two.
So treatment's a little bit different, but can we talk about the differences in the symptoms? And I know there's a lot of crossover, but if you're an average person and you start getting sick, what are some of the main differences you should look for, which kind of will tell you where you should go for help?
So I think the key thing here is everybody is pretty familiar with the flu symptoms. You get a fever, you just feel very run down, you can get the muscle aches and abdominal pain. Sometimes more children, I think, experience that. But COVID, we are seeing sometimes rapid progression of difficulty breathing in populations that we wouldn't anticipate to see that in. And that's actually our middle-aged group. So we're finding usually flu will affect the very young and the very old, but we're finding that COVID is actually affecting the people between ages 20 to 40 much more so than if it were just the regular flu virus.
Of course, one of the issues with breathing problems, and sometimes you're not getting enough oxygen in your blood, is sometimes you can't tell.
It's very true. There is some lovely technology. I think people who have like the Apple Watches have the ability to monitor their pulse oximetry, which is the percentage, it's relayed as a percentage of oxygen in your blood. Ideally, we would want that anywhere from like 95% to 100%. But we're finding that patients with COVID are what we call happy hypoxics, and their pulse oximetry can read much lower than that, but they aren't necessarily showing symptoms. So that's the scarier part of all of that.
And what is that called, the thing that you put on your finger to test for that?
Oh, that's actually a pulse oximeter.
And it's very inexpensive, right?
It is. So apparently they were going like hotcakes on Amazon. So I'm hoping availability is a little bit better now. But I feel like every household should at least have one of those, as well as a thermometer.
Okay, that is good advice. Thank you. What are the best ways? This is an obvious question, but we're not all practicing it. The best ways to avoid flu and COVID. Just, it's worth going over, I suppose.
It is. So I know everybody's probably tired of hearing it. Wear that mask, just like we're wearing the mask today for this interview. Always practice good hand hygiene. The minute you touch a different surface, open a door, or just in an element where you're not at home, definitely sanitize those hands. And this one, I cannot stress enough, please, if you are feeling ill whatsoever, cough, runny nose, you woke up with a headache and you're just not feeling yourself, please stay home.
And if they come to the practice at Padonia, there's someone to give. You'll get your temperature. Make sure you have a mask on. Everyone's going to be distanced. Is that how it's working in the
Correct.
waiting room?
Correct. So we have the plexiglass up. We have hand sanitizers all over. And then anybody who enters the building absolutely must wear their mask. And then they will have a temporal scanning done for their temperature.
All right, Kelsey Terrones, thank you. We broadly thanked healthcare workers before we introduced you, but I want to personally just thank you and all of your colleagues so much for being there for us during this time, especially.
Thank you for having me.
And we've been talking a lot about what's available at the center at Padonia, at GBMC Health Partners at Padonia. We want to show you some more of what is there. And so let's take a look inside an exam room.
Are we going to do a blooper? It's like my name is Tremonte Prelude. I'm the lead medical assistant here at the Padonia station. My role is to assist with the provider, bring the patient at ease before the provider comes in, because they get white coat syndrome. Call the patients for video visits. We check blood pressure, height, weight, and everything. So this is the way that patient enters from this side of the room. And once they get in, we close the door. See it closed by itself. Then we have them sit down. When the patient comes in, we mainly have them sit here on the table. Before we have them sit, we do the vitals, we check their height and weight. But this lucky chair here checks weight. We have the touchscreen computer. It helps everyone see, not just us or just the patient. And then it makes it easier to sign in, just like that. Just tap for your badge, sign in, and then you don't have to worry about wires. So if I wanted to stand all the way over here and document in the patient's chart, I could, which would give them space and we could go over things. We have family care. We also have pelvic floor therapy. We have Urogyn, and we also have physical therapy on Thursdays. We used to have patients sign the forms when they come in, but we're kind of going paperless. So we have the tablet here that they sign in on, and they go over health history, they sign the consent forms. It helps the process go a little faster. So once we do vitals and everything, go over medication, health history, we have them sit here, and then we leave on the other side of the door, which is the kitchen. So out here, we have where the providers and I sit. We all sit next to each other. Only provider that is here right now is Kelsey, our nurse practitioner. So this is the patient side that I was showing on the other side, but we have two sides. This is the only side they see. Then we have here, we have two virtual visit rooms. We have one here, which we can show you what's in there. It's just a computer with the camera connected to it. And then we have a little stand for the providers to put their phone on if they want to do it off the cell phone or the computer. And we have a telephone as well. We try to make it roomy for the providers as well.
Well, we've been getting these wonderful tours of the Padonia practice. I think it's a good time to really just thank our healthcare heroes and all of those who have been stepping up and going to work every single day and trying to keep this community healthy. We don't know how long, obviously, that the COVID-19 crisis will last. There is a light somewhere at the end of the tunnel as we get closer and closer to a vaccine, but it's a great time to come together and support each other in time of need. So we're asking that you please consider supporting the Healthcare Workers Fund to help those who are working tirelessly trying to keep us safe and healthy. Your gift helps GBMC meet critical needs that have already surfaced and other needs that arise as GBMC wades through these very uncertain times. They've also been receiving an influx of support of donated meals and supplies. And if you are interested in helping out the doctors and nurses and technicians at GBMC at not only the main hospital, but all the other campuses as well, you can donate food or supplies. There's a form available online to do so, and it will be incredibly appreciated. And I'm just going to give you that website. It's gbmc.org/donations. So there's a need, and this is a great time of year to give and help those who've been giving so much to us. Joining us now to talk more about GBMC Health Partners at Padonia is Dr. Joan Bloomquist, who is the Chief of Division of Urogynecology. Thanks so much for joining us, Dr. Bloomquist.
Thank you. Thanks for having me.
Yeah, tell us about what you're seeing there in the new facility from your point of view.
Sure. So first of all, it's a beautiful place. I can tell you patients absolutely love coming here. From a GYN perspective, we're fortunate that we are able to see a couple of different subspecialty type patients here. So we see some general gynecology patients, and our nurse practitioner, Janice Logan, that's her primary focus. And then we have two subspecialties that are seeing patients here. So the first is our Dr. Christine Halou, who is our minimally invasive surgeon. And she focuses on seeing patients who have kind of advanced gynecologic conditions such as chronic pelvic pain, endometriosis, and fibroids. And she's here 2 days a week. And then I'm here 1 day a week, and my practice focuses on urogynecology. So we're fortunate that,
Yeah, it's wonderful that you're there. And I would imagine that when this pandemic began, women who were struggling with, let's say, urinary incontinence or other pain put off getting treatment or going to see someone. But now I would imagine they're coming to you and they need help.
Right, absolutely. And it's kind of interesting how the pandemic has affected different people different ways. For example, some people who, if their job involves driving places and they have problems with urinary frequency and urgency, they can no longer just quickly stop at Starbucks to go to the bathroom or stop various places where they could before. And so for them, it's much harder. And other people who are working at home used to have a problem at work, but they're actually doing okay when they're at home. So it's very interesting how it's affected different people differently.
Yeah, so there have been some interesting pluses and minuses to the condition or what you're dealing with.
Correct.
I think for everyone on some level, right? Can you talk about how common this is, urinary incontinence in women?
Sure, yeah. So in general, pelvic floor disorders occur in at least a third of women at some point during their life. And incontinence is the most common of those. So urinary incontinence is probably about 20-25% of women have some degree of it. And those are probably people who are seeking care. So there's probably even a higher percentage of people who have it that never see a physician about it.
Is it always age related?
Not necessarily. There's two primary different types of incontinence. So there's one that we refer to as urge incontinence or overactive bladder. That's more the kind that generally makes people feel like they need to go to the bathroom frequently. They get a strong urge and just can't get there in time. And that one does seem to be more common every year that we're older. Stress incontinence is more the kind that makes you leak urine when you do something physical, like cough or laugh or sneeze. That is more common shortly after having had babies, and then sometimes actually even, does not necessarily get worse with age. So we see it in very young patients, 20s and 30s, but we also see a lot of older ladies with problems too.
And what are some of the options for treatment?
So it depends on the different types of incontinence. So that's why it's important to actually seek out a provider so that we can kind of evaluate to see, is this more the stress incontinence or more urge incontinence? So for urge incontinence, sometimes just doing some behavioral modifications like changing what you eat and drink can make a big difference, or drinking less at certain times of the day. Pelvic exercises can be very helpful for that condition, and medications. And we sometimes get to more advanced treatments such as Botox injections and nerve stimulators. Whereas for stress incontinence, the treatments are, again, pelvic therapy can be helpful, a type of physical therapy, vaginal inserts that sort of put some pressure under the urethra, or surgery. So as you heard me talk about, like 8 different treatment options, and I think there's sort of 2 important things here. Number one, people are always worried that surgery is the only answer, and that's really just one of about 8 things that I mentioned. So surgery is not necessarily what everybody needs.
Yeah.
The other thing is the physical therapy is the one treatment that actually can help with both types of incontinence. So pelvic floor physical therapy can be very helpful in our field in general.
And it's the kind of thing that you can do at home for the rest of your life if you need to.
Correct, yes. Generally with the physical therapy, we have you work with a pelvic physical therapist for usually between 6 and 10 weeks, depending on how much improvement you're making. And then the physical therapy gives you a home program that you can work on. And we're very fortunate at Padonia, which I think you'll hear about in a little bit, that we actually have one of our pelvic physical therapists from GBMC who is at the Padonia office a couple days a week.
Why do women get pelvic organ prolapse?
So prolapse is a loss of support in the pelvic area. And we think that generally it primarily starts at the time of childbirth, that during pregnancy and delivery, that some damage occurs to the supporting structures. And then for years, your muscles might be able to compensate for it, but then a combination of changes that happen with aging, just walking on 2 feet and, walking on 2 feet and having to bear down and live life, puts more and more pressure on that area so that eventually the muscles just can't support things anymore. And that's when women can start to have some prolapse problems.
Are there things that you can do as a woman to try and prevent that from happening? I mean, sort of live healthier things that you can do in your everyday living that can maybe stop that? Not that we're all thinking about that if we don't have it, but I mean.
Right. Yes, exactly. Yeah. Well, just in general, being healthy. Obesity is a big risk factor for prolapse, so keeping your weight under control is good. Chronic conditions such as coughing and constipation can add to it. And then also keeping those pelvic muscles in good shape. It's not a part of the body that you think about exercising,
Right.
but it actually is really important. And there's some good research now that shows that women whose muscles are stronger are less likely over time to develop prolapse.
I think the whole mesh option has been around for some time now. Can you discuss what that is exactly?
Sure. So when we do surgery to fix prolapse, sometimes your own tissues just aren't good enough to support. Those tissues have already been stretched. For a lot of women, they are, but we found that sometimes those just aren't strong enough. And so the idea of using a mesh to help with that support came about probably 25 or 30 years ago. And we do use that when we go in through the abdomen to do support. But about 15 years ago, the thought was, could we go through the vagina and use some mesh to do the surgery and get better results? And we found that it actually works really well. However, there's about a 15 to 20% risk of complications with using the mesh when we put it in through the vagina. So because of that, we don't recommend doing that. But there are still a lot of other surgical options that have very good outcomes, but they don't all need to involve mesh. And I think that's important because women get concerned. They think, the only surgery that I'm going to be given the option of is mesh, but that's really not the case. There's a lot of other options that have very good outcomes.
What are some of the side effects? It's unfortunate because you say that it really works well one way, but the side
Right.
effects over.
Yeah, so the two main things are pain. It seems like sometimes the mesh just sort of shrinks and then it pulls tension, and we think that tension is what for some people can cause chronic pain. And unfortunately, sometimes even if you take the mesh out, it doesn't always make the pain go away. Sometimes it does, but not always. The other is that sometimes the mesh can work its way back into the vagina. So if the tissues are very thin, the mesh could work its way back into the vagina, and then it can cause some bleeding or discharge or discomfort with intercourse. And then we have to go back to the operating room to remove that part of the mesh.
Dr. Bloomquist, can you talk about how, you've touched on it before, but just a little bit more about how the pandemic is sort of affecting your practice? And I'm wondering, it seems to me that telehealth, it probably wouldn't be as effective for you.
Yeah, that's a great question. Well, we definitely do telehealth, and there are some, we can, do an initial intake with a patient via telehealth, and some of our follow-ups we can. But a lot of what we do obviously involves physically examining the patient to see what's going on in the pelvis. But there are some things that we can do. And certainly if people are uncomfortable coming in, we encourage them to give us a call and see if we can't at least initiate some form of treatment via telehealth. So we're very open to that. And we really have remained, since the initial sort of down time for a couple of months, now a lot of people really need to get in and get their treatment. And so we have continued to be very busy ever since probably early June.
And so I guess you continue to urge people not to, even though we're all sort of self-isolating a little bit, but not to isolate if you have a problem, that it is you're keeping it as safe as possible to come in and seek treatment.
Correct. Absolutely. Yes. Yeah.
All right. Well, thank you. And congratulations on your new practice, at least your new location. It looks absolutely beautiful.
Yes, it's a very pleasant place to be. So.
Good. We all need a little more of that.
That's right. That's right.
Thank you so much,
right.
Dr. Bloomquist. Thank you for being with us and talking about what's happening as far as urogynecology goes at the GBMC campus at Padonia. And we want to show you a UroGYN specialty office right now.
My name is Claudette Cole. I'm a physical therapist who specializes in pelvic health. I work at the Center of Rehabilitative Medicine at GBMC, and I see patients in that location at the main hospital. I see patients at Urogynecology on the GBMC campus, and I see patients here at the Padonia facility. I treat both women and men who have any pelvic floor dysfunction. It might include urinary incontinence, fecal incontinence, overactive bladder, constipation, and any sort of pelvic pain, pelvic girdle pain, back pain, hip pain. This piece of equipment is a computer setup that does biofeedback. We might use this for a variety of conditions. If we identify that someone has discoordination in their pelvic floor, or they have a pelvic floor that's overly tight or overly weak, we might use biofeedback to give visual cueing to the patient so that they can see what their efforts are doing. And that helps them learn how to restore the normal coordination of the pelvic floor. I really enjoy working with patients to identify what issues they're having and difficulties they're having, because working with them is really rewarding when they can get back to doing what they would like to do. I really enjoy working here at Padonia. It's bright and cheerful and very welcoming for the patients, and easily accessible for the patients to come here. And I love working with the staff here.
Congratulations to GBMC for the new practice at Padonia. And while we're talking about congratulations, one other one that's a biggie. It's a major accomplishment for GBMC. GBMC Healthcare earned the Malcolm Baldrige National Quality Award. It is the nation's highest presidential award for performance excellence. So congratulations. It is, by the way, the only healthcare system in Maryland to achieve this prestigious award. GBMC Healthcare has become the first healthcare system in Maryland to receive the Baldrige National Award. It is obviously the nation's highest presidential honor. And we want to congratulate Dr. Chisar and all the staff who made this happen. A little bright spot in an otherwise very challenging year. So thank you for being with us, and be well.